Okay, so I'll be breaking down a pass in volleyball. So a description of the movement. So a volleyball pass. The goal of the pass is to uh, basically have exemplary ball control, and this entails having appropriate form and posture throughout the duration of the pass. Some factors that go into passing are your stance, your platform, your center of gravity, absorption, and the momentum at which the ball is coming off of your platform and coming onto your platform. There are also many variations of passing. Here I have some pictures of different passes. As you can see, different angles at which they're contacting the ball. On the far left, she's contacting the ball at a very low height from the ground, whereas on the far right, he's passing the ball a little bit farther off the ground, but closer to his body. The goal, the biomechanical goal is to efficiently and accurately use the legs, arms, back, and core to receive a ball and direct the ball's trajectory elsewhere. Normally, this is to zone 2, right over here, zone 2, which is close to the net, where the setter will be to take that second contact. Here I have a video of me passing the ball. So that was a little bit of an overhand pass. So as you can see, lots of different stances. So an anatomical breakdown of a pass, there's several different phases that go into a pass. First, I have listed as the relaxed phase. This is often before the rally even starts, or when the ball is not even close to coming over the net at you. Then there's the ready stance where you're alert. Your eyes are often tracking the ball. You'll have your um, feet a little farther than shoulder width apart. You'll be kind of slouched over, hinged over rather, with all your body weight on the tip of your toes. Your hands should be supine out in front of you, ready to bring your hands together to form your platform. The third phase I have is your deviation. So this is necessary if the ball is being attacked, and it might be being the trajectory of the ball might be a little bit farther away from you, so you might need to take a few steps over to then contact the ball best at that location. After the deviation, you will form your platform, which is when you bring your forearms together, your hands together, and create that nice surface so that the ball can cleanly bounce off of it and fly over towards the other side of the net or towards the setter to take the second contact. The fifth phase I have is the contact, where the ball will contact your platform. In this case, leading into that contact, you will either hold your platform just out in front of you. It depends on the scenario and a lot of different factors that go into the forces at work. Also will also kind of play a role in whether or not you hold your platform after the contact or if you follow through with your platform. There are also a lot of muscles and joints, muscle actions, joints at work. Shoulder horizontal flexion, some muscles that help with that are the pectoralis major, anterior deltoid, and the coracobrachialis. There's also elbow joint extension, so triceps brachii and anconeus are also involved in elbow joint extension, your platform. The radial ulnar joint supination, which brings your is in specifically in the ready stance. Your biceps brachii, supinator, and brachioradialis are involved in kind of supinating your um, palms upward so that you can then form your platform. There's also triple leg flexion at the hip, knee, and ankle joints. There's a plethora of muscles that are involved in kind of that hinged over and static squat stance that you form when you are passing. Some biomechanical principles, as I kind of hinted at before, there are a lot of forces at work. This falls under the kinetics umbrella. So there's the force of gravity and the force or resistance of the ball when it contacts your hand. Depending on the momentum and speed that ball is traveling, it'll have more force behind it, meaning that you'll either have to direct the force and absorb some of that force so that the ball stays on your side of the net, or you will have to apply a little force by swinging your arms and putting some momentum from your legs into that ball to bring it up at a height that is comfortable for your other players to work with the ball. The kinematics kind of went over previously. There's a lot of different motions happening during a pass. There's knee flexion and extension through the pass. There's extension at the elbows. There's also the horizontal flexion at your shoulder joints. There's supination, and then triple leg extension, as I kind of brushed on with knee extension flexion. So some anatomy analyses. I kind of researched the stretch shortening cycle. This has to do with, especially if the ball is coming at you and it doesn't have very much force, or it's a ball that's kind of floating in the air, doesn't have a lot of spin on it. You want to utilize the stretch shortening cycle so that you can apply some force and direct that ball high up into the air, because there is not much force at play. So you'll squat down low and you'll utilize your muscles storing that energy during that eccentric muscle phase, and then during the concentric, where you're extending upward into contacting the ball, that force will then be directed into the ball, propelling it up into the air, where the setter or another player can then take care of the ball from there. The kinetic chain is obviously a factor of passing a volleyball. There are triple leg extension happening during this passing movement. So if there's one factor that there's a deficit somewhere, so if you have a weak ankle, you then may not be able to pass the ball. The ball may shank off into the stands, it may roll across your platform and onto the floor. So it's important to look at all factors across your kinetic chain, not just your legs, also your core and upper body. And then there are like progressive exercises that I would utilize for training, and I'll get into this further on the next slide, where you can train and essentially replicate a lot of the movements and progress towards more difficult movements so that you have a better ball control, which at the end of the day, that is the goal when passing. So I took 2 different measurements through 2 different tests. The first test that I performed was a depth drop test. This is essential, especially when passing, so that you can drop down and control that movement to get under the ball as it is coming at you. And a lot of times you want to be able to perform this very quickly, and then direct that force either into the ball or take that force into you. Sometimes this force, on a side note, some of the force of the ball can actually be directed and absorbed into you, causing you to actually fall backwards. which is typically seen in like the men's side of volleyball. There are, of course, modifications you can do with this test. You can uh, jump or drop off of uh, a shorter or higher surface. You can add weight to it, of course. Next is the squat jump test. The application for this is not particularly related to passing during a volleyball. During volleyball. This can also relate to a bunch of other different actions happening. Of course, there's squatting involved during a pass. Um, there are modifications similar to what I described with the depth drop. I'm going to play this video of me performing and all my analytics that I gathered from these tests. So that's from the depth drop. And then these are my different statistics that I got from my squat jump test. So these two can be performed just to kind of track also the progress. So if an athlete is training, you can take these statistics in mind so that you can see if there's any improvements or any deficits that might be causing the athlete to not perform to their full capacity during the match or during a game or during a practice. So there are lots of different exercises that you can add to a program to train for this movement. I have listed kettlebell swings, which in particular work that hinge joint at your hips. There's also the power clean, which is more of a full body exercise, but I will say that it's important to be explosive, and there's a lot of forces at play during a pass. A lot of different muscles that are utilized, whether it be to direct the ball directly correlated with passing the ball, or they're just stabilizers such as like the back and the core muscles. Force vector training is also something that I've listed, which is very broad, but there's a lot you can do with this. There are so many different unique pieces of equipment that you can utilize to train, replicate different actions and different situations found in games on the court. Related to passing, there are not too many injuries. The main one that comes to mind is concussions. Obviously, if a ball is headed towards you at a very fast speed, it may be hard to get out of the way, so you may absorb that into your head and as a result get a concussion. But when you're in the back row, you're typically not at risk for injury. This is usually a front row player kind of. That's where the injuries take place, is when you're closer to the net, where you may land awkwardly or you may land on a teammate. In the back row, the only thing I can think of is maybe tweaking your ankle slightly, or possibly injuring your back if you're not taking a pass correctly and you're not allowing your muscles to work together for that pass. And these are my citations.